Good morning, everyone. This is Dr. Adewale Badru. I'm here to give this lecture for the Ibtc students, and I'll be talking on the topic, you and your health. And I will implore you that you should pay attention because you may hear some information that you have known before that will be re-emphasized, that will help you, and maybe some information that you have not heard about that will also help you. Now, when we talk about health, health is actually an optimum well-being that contributes to the quality of life. It is more than just being free from diseases. Health is all-encompassing. An optimum health consists of good high level of mental, social, emotional, spiritual, and physical wellness within the limit of one hereditary and personal ability. So when we talk about health, health is all-encompassing as far as human being is concerned, because human being is made up of three entities: the body, the mind, and the spirit. If any of these three entities is distorted, there's bound to be unwellness. So therefore, for you to maintain a good health and a good health, you need to take care of your body, your mind, and your spirit. And you are in an institution whereby you have come to acquire knowledge, spiritual knowledge, to be able to be fruitful and to be dutiful in the work of the Lord and in the ministry. So therefore, you can see that your spirit that you have come and your mind that you have come to develop will really be able to have an optimal state if you can take care of your body, your mind, and your spirit. So therefore, there are dimensions to health and wellness. And as I've listed here in this slide, there's an emotional dimension, intellectual dimension, physical, social, spiritual, occupational, and environmental. All these things that I've mentioned here, they are dimensions to health. And if any of this entity here is distorted, there's bound to be some challenges. So you can see now, this one is now broader than just the physical, the health of your entity, which I mentioned earlier, your body, your spirit, your mind. Now, I've broadened these dimensions to health now. So, and I will be talking about some of these things as we progress in this lecture. Now, there are things that are very, very vital when you want to live a healthy life. This includes regular physical activities, eating well, eating balanced diet, managing stress, avoiding habits that can destroy you, and adopting a good safety health habits. And you must also learn first aid, because when you apply first aid in situations that confront your health, you'll be able to abate complications. And also, you must also adopt good personal health hygiene, good personal health habits. And you must also seek medical advice, seek medical consultation in a situation whereby you are faced with health challenges. And you must also be an informed consumer and protect the environment. You are in an environment here, you need to protect it. Now, I have decided to put a lot of pictures because pictures speak a lot of volumes, and I'll be showing us pictures in this lecture so that it will be able to drive home the point. Look at this man here. This man is in this middle age. As some of you that are in this program, some of you are in your middle age, some of you are in your old age, some of you are young. Whichever age category you find yourself, this is a very fantastic environment, a serene environment. Don't just sit down in one spot. Ensure that you exercise your body. It will help you to live healthy. If you cannot run, walk. Have a brisk walk around the campus. If it is one, maybe for 15 minutes, you can now graduate to 30 minutes, 45 minutes, and to 1 hour. Take advantage of this serene environment and exercise your body. It will go a long way to making you to be healthy. And you must also ensure that you take a lot of fruit, because this will help you to live a healthy life. Taking fruit will improve and increase collagens and increase the immunity of your body, which will help you to live healthy. So as much as it lies within you, take a lot of fruit. There are a lot of plants all around here. I don't know if the school management will say you shouldn't take fruit, but if they will not even allow you to be plucking those fruits, make sure you buy fruit and you take a lot of fruit. This will help you a lot to improve your immunity and to help you to live healthy and to live a more healthy life. And look at this woman here. This woman is excited, she's happy. For you to be able to wade through this program, you need to make yourself happy. This is the emotional part of health. Happiness, as they say, is free. So therefore, ensure that you make yourself as much as possible to be happy. There are a lot of things that can make you sad, but choose to be happy, because this will help you to maintain a good mental health in this program that you have found yourself. Be happy. When you see things that want to make you sad, try not to be sad. Choose to be happy. It is a choice. To be happy is a choice, and make a good choice of being happy. It will help you to maintain a good mental health. And then another thing that we cannot overemphasize here is for you to maintain a good personal hygiene. Keep clean, keep healthy. Keep clean, keep healthy. They say cleanliness is next to godliness. This is true. And for you to live a good, healthy life in this program, maintain a good personal hygiene. And if you are challenged physically or health-wise, you might need to see a doctor. You might need to see a doctor. And when you see your doctor and your doctor make your prescriptions and place you on treatment, please try to comply. And if the doctor places you on some strict medical advice, I will advise that you keep to the medical advice. This will go a long way to helping you to live healthy and to be able to wade through the stress of this program. Now, you must also learn some first aid. If you sustain wound, try as much as possible to treat your wound. Don't just behave like a little child by pouring sand on your wound. No, don't do that. Try as much as you could to take care of your health. Apply methylated spirit or iodine and take care of your wounds, for instance. And if you have a cut, apply pressure, wash the wound, apply pressure so that you don't bleed unnecessarily. People have bled so much because they don't know what to do. Apply pressure on your wound. And though I've said I should learn first aid, I've taken it upon myself to create a YouTube channel wherein I will be teaching people on various things that will help you to be knowledgeable and to be informed about things that you can do on your own. And this YouTube channel is just starting. And I believe in the next 1 month, there will have been a lot of topics that I will have treated, ranging from first aid and so many topics. So the YouTube channel is Dr. Adewale Badru channel on YouTube. So just give me 1 month, I will have been able to make a lot of videos that will teach you on issue of first aid and many other things that are pressing and that can affect health if one is not knowledgeable about them. And because this is a program for mainly pastors and we don't really have much of females, so I may not be talking much about ladies' health, but I will talk more about things that can easily affect you in the course of this program. Now, one of the things that you will be exposed to in the course of this program is malaria. Malaria is a masquerade that has killed many people in Africa. And when it comes, it might present with fever. Your body is just unduly very hot. And when this happens, please, I will advise that you seek medical care so that the malaria will not get complicated. Now, look at the child, fever, just running fever, your body is unduly hot. Now, I want to advise, because this institution has a boarding facilities, please make sure you buy a mosquito net and attach it to your bed, please. If you are able to overcome not being down with mosquitoes and malaria, I can say that you have been able to overcome 50% of the challenges that you might be facing in the course of this program. Buy a mosquito net and tie it around your bed. If the mosquito net is newly bought and is impregnated with chemicals, please ensure that you spread it for at least 24 hours before you attach it to your bed, because some of those chemicals could cause allergy. I hope I'm clear on that. After 24 hours, you can now tie the mosquito net around your bed. Now, other things that you'll be faced with here are communicable diseases. And these are diseases that can be spread from person to person. Some of them are flu-like. as we saw in the last pandemic, where people are coughing and they are passing viruses of corona from person to person. So try as much as possible to prevent and to protect people. If you know that you are coughing and you are sneezing and you have diseases that are infectious, please try as much as possible to cover your mouth, cover your nose, and don't come and spread disease here. You might need to excuse yourself if you have diseases that are communicable. And I want to tell you things that you can do to prevent disease from being spread even on campus. Try as much as possible to wash your hand from time to time with soap and water, or use alcohol-based hand rub. And if you are coughing or you are sneezing, use a face mask. And try to stay at home if you have a disease that can easily be spread. And for those of you that may be having asthmatic problem, if you are exposed to allergy, there's bound to be recurrent of your asthmatic attack. I want to implore you, come with your inhaler. It is true these things are very expensive now, but prevention is better than cure, because you'll be entering into the time of cold weather, and this may trigger attack. Please come with your inhaler and those drugs that can also prevent asthmatic attack. Prevention is better and is cheaper. And if you have asthmatic attack, please, you might need to see the health workers, maybe a nurse or a doctor, that will help you to, as much as possible, not to enter into respiratory distress. Now, I'm talking about diabetes mellitus because of the age of the people that are here. If you are having diabetes mellitus, I will implore you that you take good care of yourself. Try as much as possible to prevent taking of excessive blood sugar. And if you sleep and you are urinating excessively, you are unvalued thirsty, and you are eating too much, and yet you are losing weight, please, you may be suffering from diabetes. So what I will advise is that go and do a medical check so that they can check your blood sugar, fasting blood sugar, and they'll be able to know if you are having diabetes mellitus. But if you're having diabetes mellitus, it is confirmed, I will employ that you should try as much as possible to reduce, sugar related drinks and food, and try as much as you could to live an exercise feel life while you are in this program, so that the excessive sugar in your body can be utilized by doing exercises to burn this excess blood sugar in your system. Those that have developed ulcer, maybe because of incessant fasting and prayers, please come with ulcer preventing crisis drugs like Gelusil and all the ulcer preventing syrups. Please try to prevent this, because the complication of it may not allow you to enjoy the program. For those of you that are going through undue and over stress, maybe your blood sugar is high, please try to check your blood pressure. Your blood pressure is high, check your blood pressure regularly. Check your blood pressure regularly. If you are hypertensive and your blood pressure is above 140/90, you might be suffering from hypertension. Try to take it in a different time, maybe early in the morning or later in the evening, to see your blood pressure level. And I will also advise that you take less of salt, because it has been proven by research that hypertension in black is salt related. So try as much as you could to reduce salt intake. And whenever the opportunity arises, please take time to rest. And if your mind is overcharged with problem of the world, please take solace in the promises of God. We are all Christians, we are all children of God here. Take solace in the promise of God and cast your burden unto the Lord. Another thing that you are going to be experiencing and be noticing is your eye. You may now realize that you cannot see very effectively if you sit maybe at the back of the class or in the middle of the class. You may be short-sighted or you may be long-sighted. If your eyes is not seeing well, you might need to see ophthalmologist, so that maybe if it is a refractive error, they might need to give you glasses so that you'll be able to see very well in class. Other things that could cause eye problem could be cataract or glaucoma. But how will you know this? You need to see an ophthalmologist. You need to see a doctor, so that they will check your eye and they'll be able to tell you the exact thing that you are going through. And I will advise you, if you have glaucoma, please don't joke with it, because glaucoma is a destroyer of the eyes and can cause blindness, so that you can quickly pick it up and then quickly begin to address and treat it. Now, I will talk about tuberculosis, because these are airborne disease that can be spread on campus. If you are coughing and you are coughing out sputum that is blood stained, you may be suffering from tuberculosis. So I will advise that you need to go and do some tests, mantle tests, so that you can check your system to be sure that you are not having tuberculosis. And tuberculosis can easily be picked. Look at this picture of this man. This man is emaciated and is coughing, and as he coughs, it's an airborne disease that can be spread into the air. Anybody that inhales it can easily catch tuberculosis. So if you have any of these disease, please ensure that you go to the tuberculosis center, so that they can place you on intensive medication that will zero convert you to negative, and then you can live a more meaningful life. But if you have it, please, you need to report to the hospital so that they can take good care of you. Well, this is a pastor's place where we have a lot of prospective pastors or pastors that have come to update themselves. But sexually transmitted diseases is on the increase. Please try as much as possible to take care of yourself and live a sexually pure life. I will not talk much on this. This is a pastor's gathering. And other things that we are seeing that is rampant now is cancer. I will employ you, if you are 40 years and above, try to do your PSA annually. And if you have a wife, let them do CAE and mammography to check if there is any lump in their breast. And if you notice any of these things, or you notice any abnormal growth in your body, please report to the doctor so that he can subject you to investigation and quickly nip it in the bud. Cancer will not kill if it can easily be picked on time, but when cancer has spread and it has eaten deep, it becomes a problem, it becomes a killer. Now, this is a gathering of prospective pastors and people that want to improve their ministry. I've noticed that other things that could put people into health jeopardy here is emotional crisis. And I will implore you, make sure you attend fellowships. If you don't attend fellowship, it has a way it affects people. And those that are in backsliding state could also be affected. It can affect their spiritual life, and then this can now spiral into health challenges. If you have a spiritual breakdown, or you are feeling that you should kill yourself, please make sure you see pastors so that they can pray for you and cast out any spirit that is trying to bring you to this state. This is what I've compiled for this, and I hope this will help you. And I also will implore you that you should take good care of yourself, and God will help you to have a successful program and a successful successful empowerment in your ministry. Thank you for listening. God bless you.